This is Sandy Tankis, and I'm in New Hyde Park with Dr. Wendy Freed, who is a gynecologist connected to North Shore Hospital. Good afternoon, Dr. Freed.
Good afternoon. How are you?
I'm fine, thank you. And Dr. Freed works with Northern Obstetrics and Gynecology, is that it?
That's correct.
Okay, well, thank you for speaking to us today. And what I thought would be interesting for our viewers was to talk about menopausal women. And at what age do women normally go through menopause?
The average age of menopause in the United States is 51 or 52. Having said that, many people go through it earlier in their early, mid, or late 40s, and there are also many people who go through it in their later 50s, even up to 60.
And are there really terrible symptoms? We all hear so many stories about menopausal women. How much is true?
Yeah, well, there are some people who are plagued with terrible menopausal symptoms, and some people really have no significant symptoms at all. There's such a wide variety. The good thing is the majority of women, about 85% of women, if they're going to have significant menopausal symptoms, they usually are self-limited. Within 6 months to 2 years of getting those menopausal symptoms, they usually go away. However, 5 to 15% of the female population will be plagued with ongoing symptoms even later on in their 60s and 70s.
And I know that women used to take hormones, which were great at alleviating some of these symptoms. And now, of course, doctors say that women shouldn't be taking these hormones. So what can be done to alleviate these symptoms if you can't take hormones?
Well, first of all, the issue with hormones is a very complicated one. And in 2002, the Women's Health Initiative study came out and it really put a big glitch in the hormone situation because it showed that there was an increased risk of stroke, heart attack, and breast cancer in women who were taking hormone replacement therapy. However, the pendulum has swung a little bit over in the other direction in later years because not everybody should be on it, but not everybody should be off of it. That small subset of people that we spoke about before, that 5 to 15% of women whose life is altered dramatically because they're miserable from menopausal symptoms, they still may be a candidate for hormone replacement therapy. The big issue is that we have to individualize our care to each one of the women that we take care of. So we need to take a detailed medical history, family history, personal history, and symptomatology history to find out what the woman is experiencing and exactly what we can do about it. So when we find out what's going on, depending on how severe the symptoms are, there are a lot of things we can offer people, both hormonal options, but also non-hormonal options. And a lot of what I wind up doing is starting out teaching people about some of the basic interventions that we could make that don't involve medication at all. They involve lifestyle changes, they involve dietary modifications, exercise, and then if that doesn't work, then we can move on to some of the non-hormonal medications and non-prescription medications, and then ultimately, if the symptoms still persist and are severe, we can then talk about prescription non-hormonal medications and prescription hormonal medications depending on the individual patient.
Well, so there is some relief in sight if women need it, in other words, without the hormones.
Sure, absolutely.
What about insomnia? That's another acute complaint for many menopausal women.
It certainly is. A lot of women complain of insomnia when they are perimenopausal or menopausal.
And what can be done with that? Anything?
Again, we have a lot more options when it comes to the hot flashes and night sweat situation. We have less in the way of insomnia. Certainly some lifestyle modifications with the insomnia, going to sleep at the same time every night, trying to sleep in a cool room, and not having any hot beverages or caffeinated beverages before somebody goes to sleep. All of those things can help. And if still after that the insomnia persists, we can talk about mild medications. Sometimes even using something as easy as a little bit of Benadryl at 10 o'clock at night, taking 25 milligrams of Benadryl may be something that's very beneficial. In people who have really severe insomnia that interferes with their life and functioning the next day, we may have to talk about using medications. But again, just like we talked about with hot flashes, you want to start in the basement and work your way up to the attic.
Right.
You want to try to stay away from just throwing medication at people, and you really want to try to see if you can use non-medicinal things first.
Well, there are so many things on my list, but I think I'm going to limit it to just one more. A lot of women complain about weight gain during menopause. Is there any truth to that?
There certainly is some truth to the weight gain situation. I mean, all mammals gain weight as they age, whether you're a dog, a cat, a horse, or a human. So people do gain weight with time, but there are things that you could do to counteract that. Menopause, it becomes a more challenging situation both hormonally and personally for a lot of women. Getting out there and being more active and exercising, even if the diet doesn't change at all, even just doing a brisk 30 to 45 minute walk every day can wind up revving up the metabolism. It can burn calories. It's good for the bones because, again, we bring in the whole situation with menopause, lack of estrogen, and osteoporosis. So that can kill many birds with one stone. It can help your sleep. It can help your hot flashes. So there are so many different things that are improved by changes in your exercise and in your diet.
Well, gee, thank you so much, Dr. Freed. I appreciate you speaking to us today.
Thank you. It was a pleasure.